Okay, so really the question that we wanted to center the group around tonight was one that I think those of us in the data visualization community have been um, considering, thinking about, and taking action on. And that's, how has Tableau allowed you to see and understand trends attributed to COVID-19? We've seen some incredible data journalism over the past weeks and months in regards to the pandemic. And we've seen businesses, nonprofits, organizations use data visualization to better understand the trends associated with the virus in their operations. And so we thought it'd be just a timely opportunity to, as local user group, just consider this question. And so we're going to have presentations by a couple local users, and we're going to have a couple guest speakers. I mentioned at the forefront, Amanda and Jonas are joining us. So without further ado, I'm going to go ahead and introduce our first guest speaker. And so our first guest speaker is Amanda McCulloch, and she's the Senior Data Visualization Lead at Excella. And she holds a Master of Public Health from Boston University School of Public Health. She worked with the data in global health programs for 8 years before joining Excella in 2017. And there she leads and develops user-centered data visualization products for federal, nonprofit, and private sector clients. And she volunteers as the ops director at the Data Visualization Society and is the co-organizer for Data Visualization DC. She's on Twitter at AB McCulloch, and you can find her using that handle. So with that, I'll go ahead and pass the ball to you, Amanda, and you can kick things off.
Thanks, Christian, and thanks for the invitation to join you guys today. I suppose it is one of the silver linings of these virtual sessions is getting to pull in people from all over the world, which I'm honored you gave me the lead-off spot instead of our friend here from Switzerland, who probably needed the earlier spot more than me. So I'm gonna lead us off today talking about, let's see if I can get this full screen. I want to talk about some of the broader questions and ethical questions that we have about how we visualize and look at data and information. So I want to put the punchline right up front for my talk today, which is that we should all follow this principle of first, do no harm, and keep that in mind as we think about the things that we're publishing and sharing about COVID-19 and really anything else that's sensitive, especially health information. So we know that COVID-19 charts are functionally everywhere, right? There's charts on every single news outlet. It's the top of the fold thing on every single local paper. It's the thing that people keep looking at to try to make sense of the world around us. And I can't blame anyone for that, for the sense that that's the information we crave and we need to try to make sense of a really uncertain time. There's also the fact that we had the flattening the curve infographic. This is an infographic that had many different iterations of it. It's not based in real actual numbers or data, but it arguably helped to make the case for why we should stay home and do some of the things that might feel hard right now, but really are helping to further public health. And we've seen a lot more visualizations trying to make sense of complicated models. So there's complex mathematical models trying to tell us about, say, for example, when hospitals might become overloaded or other issues, problems, or concerns. And so as we think about that, and as we think about kind of what that looks like as data visualization designers, the visualizations are powerful, right? They're ways that we make sense of information and complex data. And the data has been made very available in the current environment. Johns Hopkins was the first to publish kind of a virtual repository of the case and death data globally. People can argue all they want about the front end of their visualization and their dashboard, but they were the first to really put out a machine readable, easy to access data set that's been picked up and used by Tableau. AWS has a data lake out. There's lots of different sources for the case data, which makes it staggeringly available. And we found that it's really valuable to have out there. It's been used to persuade and understand current conditions and in some ways try to predict future outcomes based on behaviors. And this quote from Stephen Drucker is actually from a post we have on DVS's Nightingale, all about the ways in which this has been a shining moment for data visualization, which I wholly agree with. I think we've enabled understanding as a field in ways that no one has before. We've seen the Financial Times and the Washington Post say their most viewed pages of all times are their COVID-19 visualization pages or the Harry Stevens flatten the curve infographic. But the question I want to pose is, how do we reconcile our need for evidence and data and our desire to visualize that data with the amount of uncertainty we have in the case data. And that's where I'm going to focus my time today, because while the case data is something that I've seen enough dashboards at this point, I think, I think we'll continue to see it be folded in as we look at other economic indicators and other information. So it's really important that we start to think about how we can have a better understanding of that case data and some of the nuances in it. And that requires us really digging into the methods that are being used to kind of model and analyze the data if we're looking at some of the outputs that are being visualized, but also just looking at what the data sources are themselves. As we look at case data, a case is not always a case. Those qualifying words like confirmed cases or probable cases are really important. If you go back to February and you look at the trend charts for China, you see this odd blip that happens where the daily count jumps in mid-February. You see it in some of the charts on Data Wrapper and otherwise. And the reason that that jumps up is not because there was some kind of huge influx of new cases that happened that day. They changed how cases were counted. And so we saw an increase. When we think about what cases mean, this is an example of a table from Ohio. The data is a little bit out of date at this point, but they actually release 2 different data points each day in their daily updates, because they need one data point to align to the CDC standard and a second to make the numbers in Ohio comparable to their neighbor to the south, Kentucky. We have to think about how that definition has changed, like I said. So this is that reference line around China and how China changes the way it collects the data. This is actually a default in one of the Data Wrapper charts that's out there. And these kind of reference lines and points that help an audience understand and make sense of why they see weirdness in the data is really important. There's a lot of noise and lags and other things that come from reporting, not from the actual data itself. We also have to think about what kind of share of cases are being represented. So there's some modelers out of the London School who have been trying to estimate what share of actual COVID-19 cases are being actually registered and logged as confirmed cases in different countries. You can see the wider the bar here, that's the wider the range in terms of the confidence interval. The farther the bar is over to the left, the lower the share of actual cases that are being actually reported and captured. And for the US at this point in time, it was looking at like it was around 12% of cases with a pretty wide kind of confidence interval. We also have to understand how routine data gets collected. I know that this isn't the sexy, fun, cool part of understanding and looking at public health data, but health information systems and the ways in which data is captured and used are really important. This is the form for how you actually capture case data for the CDC. And as you think about all of that data and information that has to be filled out, understanding what's mandatory, what's not, how different kind of data gets aggregated and collected and then moved up a pike from the county to the state to the country, helps us understand why there might be lags in that data. We have to think about how study data is collected and be more cautious about how we interpret and retweet and share big snashy headlines. This is an example of someone digging into some of the data around smoking and it being a risk factor for COVID-19. And in the response that this person got when asking about this paper, the study author said, in our paper, COVID-19 on COVID-19 characteristics, many patients cannot answer questions about whether to smoke because of their older age and serious illness. Therefore, the proportion of smoking in patients with COVID-19 is low. That doesn't mean that the proportion of smoking is low. It means you had a lot of unknowns in your numbers. And we have to think about what those known unknowns are as we look at data. If you trace back a lot of the data we see in journalism nowadays, oftentimes it traces back to these morbidity and mortality weekly reports coming out of the CDC, which are functionally technical reports, right? They're written primarily for a technical audience. It's a standard weekly report the CDC puts out on really important topics. And in this case, we're going to look at the underlying conditions and the risks around underlying conditions in terms of severity of coronavirus. And this report that came out on April 3rd is actually the one that helped to define what some of the risk factors were in terms of ICU hospitalizations amongst people with pre-existing conditions. So remembering this date, we're looking at the end of March, March 28th. This is the chart that landed in NPR, which I have a ton of respect for NPR. They're doing a great job on all of their coverage. They have some nice clear notes about what the sample size for each of these are. They put a nice clear headline at the top in terms of nearly 28% of patients who had chronic renal disease were treated in the ICU. You could make a couple kind of small tidbit little changes to really call out that this is your no pre-existing conditions bar that you're comparing everything else to. So it really helps to reinforce the fact that some of these are a really high percentage. But at the end of the day, what caught my eye was that this was data for 6,637 cases. And these were the cases that actually had all of the data needed. And at this point in time, at the end of March, we had over 122,000 cases reported in the US. So as this is being presented with these percentages on a bar chart, it seems very certain, right? It makes us feel like we have a lot of confidence in these numbers. That's what data visualization does for us. But instead, you're looking at 6,000-ish, 6,600-ish cases out of 122,000 cases. And if you go back to the original report, right there at the top of their table are in bold are all of the different missing cases that do not have status known. So hospitalization status unknown up here. And so I think we need to be really, really cautious and careful as we look at these things around the denominators we're looking at and what the known unknowns are. Because we have enough unknown unknowns about a new and emergent disease without having to complicate matters further by overstating the generalizability of findings with our known unknowns. And all of these things help us make better sense of why modeling COVID-19 and making any kind of forecast is really messy. 538 has had some excellent pieces, including the one this graphic is from, that talk about the various nuances in modeling COVID-19. And I'd encourage you to take a read through that article. So I want to go ahead and leave you with a few ideas on how might we viz responsibly, because I don't think it's fair to say that no one should pick up a Tableau license or another data visualization tool and ever visualize data about COVID-19 unless you're an epidemiologist. Clearly, we have data journalists doing great work and others doing great work in amplifying and sharing new insights. But I think there are certain questions we should ask ourselves about how we can do this kind of visualization responsibly, because that bar, that mantle that we carry is higher when our visualizations could misinform. So this is where it's important from the start to align on our values and our values as data visualization professionals. Bridget Cogley, one of the Tableau Zen masters, has a really excellent article on her blog, tableaufit.com, talking about ethics of visualizing data in a pandemic, and has a much more detailed list of different questions to ask yourself before you publish visualizations of COVID-19. But she makes this point about value prioritization and alignment and the things we have to consider as we visualize data, and how for many of these things around do no harm and trust and justice, we really have our values shift to be even stronger in a pandemic situation where misinformation could cause someone to ignore public health advice. So I'd highly encourage you to take a look at her blog and think about what are the values that we share that really go back to why we are visualizing and sharing information. A collaborator of mine on an ethics of data visualization of COVID-19 we were working on our draft this morning, and she actually wrote that an irresponsible use of the case data is for public-facing learning. And I don't disagree with her. Use it on your own terms, but it's not a great training data set to publish up to Tableau Public just for funsies. So 1, seek or demand honesty about uncertainty in the numbers. If you're working with case data or numbers, either as a visualizer or a reader of charts and graphs, seek and look for the uncertainty to be stated. The most legitimate models and graphs are going to be explicit. They should be. They'll tell you this is a reported cases from the United States, or this is hospitalizations, and this is the time frame. And if that information and data isn't there for whatever data set you're looking at, just don't look at it because it may mislead, even unintentionally. This is from an interview we did for Tableau with Dr. Ellie Murray from Boston University, talking about different considerations for data visualization professionals from the perspective of an epidemiologist. As we look at this, this also means very transparent and making notes about that uncertainty as you publish visualizations. These data wrapper charts have some really excellent notes on them around why they do or don't do different things. It kind of harkens back to great data visualization style guides, or when we make recommendations to people, we often say, here's what you should present or do, but also why to do it that way. We should help our audience understand the why of the charts we plot and the information we share. 2, always consider the people and the stories represented in the data. I fear that we have become numb to the reality of what it means to lose 3,000 Americans in a day. This for me harkens back to Data Humanism, a manifesto and set of principles from Georgia Lupi. She did the Dear Data postcard project, sending postcards back and forth with Steph Posavac for 52 weeks. And it focuses on the fact that there will be imperfect data, but we should focus on some of the small data and the stories. So as you're thinking about how you can contribute around COVID-19, I would look to what are the untold stories that haven't been surfaced yet. She and her team actually reimagined Andrew Cuomo's briefing slides. One example here is that instead of going ahead and doing bar charts of lives lost, she made each individual point an individual and unique smudge on a page. And it looks almost like a constellation of stars to me. And when I think about this, this is such a more poignant and pointed representation of these lives lost that really focuses on the individuals that are gone, rather than focusing on everyone being aggregated into a bar chart. I also think about imagery and pictures. So Jose Andres shared these images from Idaho and from San Antonio. And when you juxtapose them together and look at those two pictures side by side, those two things together are what tell the story of what's happening in America today, more than almost any other data visualization that I've seen. So don't forget the humanity and the stories and the people represented in your data set. 3, collaborate with subject matter experts like epidemiologists. There's a great game by Shirley Wu called People of the Pandemic. It's a simulation exercise. You can go in with your zip code and make different choices about how often you'll go out or not. And it will give you an outcome, and you will play against other people who are playing at the same time or next to that. And so it's a very interesting game to play. It's very experiential in terms of what happens. I got to see the hospital beds at Georgetown MedStar Hospital filling up, which is a hospital not far from me. But in her notes and in the game, she puts in a very explicit disclaimer about what these look like and makes very clear that this is not a game about COVID-19, but rather a simulation with a similar exponentially spreading disease. And she's very clear about who she collaborated with. So her primary collaborator was Stephen Osserman, who has a master in spatial analysis for public health and has a lot of subject matter expertise. 4, seek feedback. How could what you've designed be misunderstood or misused? I'm going to both call out and celebrate, but also point to Christian's visualization on Let's Keep Things Flat that was featured on the Tableau Resource Hub. It's a great visualization with a lot of detailed information in it, focused on that guideline around 14 days of declining cases in order to inform reopening. And there's a lot of really valuable information in it. But what could be misunderstood about this, right? What could be taken away differently than what we might expect? Someone might see blue and say, well, almost all of Ohio is blue. Like, clearly we can go ahead and just reopen now. And people might misunderstand that information. So Christian's done a great job of putting a lot of additional context and containers and a whole blog post all around the methodology that makes those kind of constraints and considerations very clear. I think all of that extra information helps to wrap all of this in context and how it's meant to be understood. But even though that happened, I still saw Salesforce 2 days ago go ahead and point to the fact that there is this great dashboard being used to only track the downward trajectory of documented cases and inform reopening. And this visualization to me was just as much about informing where not to reopen as it was about reopening, which makes me feel like sometimes even fancy smancy marketing teams really miss the mark. And 5, the last I have here, seek other data besides the case data. We know it's uncertain and has a lot of messiness and is dependent on testing, especially in the US. What else can we analyze to make sense of these months? We're starting to look at things like excess deaths to try to better understand what's happening in the world around us. And we've seen these on the Financial Times and The Economist. There's also other ways that states and counties are trying to quantify what's happening. For example, this from Washington State is the risk assessment dashboard that they're using to try to give a much kind of more visceral, easy to understand rating. Each of these gauges, which I know many of us may not love gauges, but it is effective for non-data people, actually goes into detail and is a combination of different points. For example, here, case and contact investigations, telling you where that data is coming from. So they're looking for other data points besides the uncertain case data. And finally, if you're doing any amateur analyzing, modeling, visualizing of COVID-19, just pause before you publish. I know a few different prominent folks in the Tableau community who have been doing some great visualizations behind the scenes and have said, you know, until I get this kind of signed off on by someone who's really in the weeds of dealing with this problem and understands the situation, I'm not going to make this public facing. And I really appreciate that, for having that much consideration on how data might be misunderstood. And remember, as we said at the start, just always think about how you can make sure to first do no harm. So with that, I'm going to go ahead and leave it to any kind of quick questions. I know we're about at time. There are a couple of resources here in case they're interesting for you. DVS has lots of good things. There's some Nightingale COVID-19 articles that include things like some checklists on other more detailed considerations around the COVID-19 data, and some great interviews with folks like the Reuters graphics team and John Byrne Murdoch from the Financial Times, talking about their process, which is fascinating. And finally, I'd highly, again, encourage you to read Ethics of Visualizing in a Pandemic from Bridget. So with that, Christian, do we have any questions that you want me to tackle? Are you on mute, Christian?
I should be getting better at that, right? I mean, I'll say it again. Just remind everybody attending, if you do have a question, feel free to enter it in the Q&A panel of the WebEx, and we'll make sure it gets asked. I don't see any at this point, unless I'm missing it.
I know it's a really upbeat talk to start off with, but lots of good heavy things to think about as we walk through other visualizations and charts and graphs.
Absolutely. One more time, any questions for Amanda? Going once, going twice. All right. Well, Amanda, thank you so much for presenting, for taking the time to join us. And I appreciate what you shared. Definitely a worthy challenge to the data visualization community during this time and beyond. So thank you.
Of course. Who am I handing it over to next so I can promote them to presenter?
Go ahead and hand it to Jonas.
Excellent.
So Jonas Nart is joining us all the way from Switzerland. He stayed up late tonight. Thank you once again, Jonas. Jonas is a data analytics and data visualization specialist. He's worked as a power trader, an equity derivatives trader, and a consultant in the energy and healthcare industry in Switzerland, Singapore, and Shanghai. He's been lots of places. He currently is the VP for power markets and data analytics for a startup in Asia, and also works as an independent data Tableau consultant. I reached out to Jonas to see if he might be interested in presenting because he has, I believe, one of the most viewed COVID visualizations on Tableau public with over 315,000 views. And I believe Jonas can speak to this, but it was picked up by several outlets in Europe as the virus progressed. So with that, I'll go ahead and turn things over to Jonas. And thank you again, Jonas.
Can you guys hear me? Okay, so let me share my screen. Okay, thanks Christian for inviting me, and I'm very happy to show the dashboard and share a bit of the design considerations, and yeah, looking forward to this. So as he said, this is I call it the COVID-19 trend tracker, because I'm mostly focusing on the trends rather than the absolute numbers. We're going to go to that a bit later. And so let's get started right away. Just quickly, my Tableau history. So I started to use it first myself as a business user because the reports we got were just not that great. So we started to do it ourselves. Then I started to have a bit of a consulting experience, and I just got more and more into Tableau because I feel it's not just useful, it's fun, and it's a bit creative as well. So yeah, I worked for Roche, so Christian as well, so for 4 years, and I do a lot of small projects. I do mostly dashboarding, and I feel that's something that you will see in the dashboard that I did. And because it's for a big organization, so scalability is very much important for that. And I think that's also very important for that dashboard. So I'm going to talk about that quite a bit. I did mostly in finance, but also some other stuff. Okay, so why this COVID trend tracker, or how did that start? So as I've been living in China, I followed the story quite in detail with my friends and see what's going on. And I kind of noticed that in Europe or in Switzerland, it seemed like very far away, and people were not really taking it serious. You feel like it's not going to come here, even though it's kind of obvious what's going to happen. So it's kind of in Switzerland. I couldn't travel to China because it was, because of the virus being there. And then I read this paper from Thomas Pueyo. I think maybe a lot of people have read it, and that really drove home the point that, in a very concrete way that we're going to be there very soon. So my brother always tells me, now you always visualize P&L and finance. Why don't you do something useful and, something that is useful for the world or some, to whatever extent. So I offered my help to a friend of mine who works at a Swiss newspaper, and they have been starting, he's like the head of storytelling or something. And so I just said, I can do Tableau, I'm willing to help, I know China, and so if you want to do something. So we started to work, and I just gave input. I helped them, and they created for the newspaper just a lot of visualizations. And they're developed by someone else, just with a real front-end tool, but just based on my design. So it was very interesting to work with a journalist for the first time, because it's very different than doing a corporate dashboard. And so article came out, but I used my own charts in the background to make my own dashboard, and I put it to Tableau Public. And this is actually the first time I did that, even though I used Tableau like every day, 5 hours for the last 5 years. So that was very good experience. So what were the, oh, I just did the slides 10 minutes ago. So, what were the design goals? So I think the numbers in generally, I use the word unreliable. You can say questionable, you can say hard to compare, you can use many words. I think Amanda just spoke about that. So what I found, I don't want to focus on the numbers, I want to focus on the trends, because the trend and the trend lines and the exponentials are very much comparable between the countries. So that was one point. Second one, I'm just showing numbers. I didn't want to get into this, interpretation, what does it mean? Or, when you see these gauges that she just showed, kind of like KPIs, is it good or bad? Because yeah, that's a very different game, and there's question on the numbers, and you need to really know your area. So I didn't want to do that. I just want to show the plain numbers here. And I want to actually encourage people to think about it. I don't want to say this is good and this is bad, right? So another key thing is this thing with exponential growth, which I think most people having a hard time to wrap their heads around. So how to do that? The other thing is we have 4 numbers like total cases, new cases, total deaths, new deaths, how to do that. And then the other challenge is different audience group want to compare different things, right? Some people want to look at this country, at that state, so how to do that. And then the other thing is about mobile. I never did something much on mobile. So of course you have a link in newspaper, most people will see it on mobile. So how did I deal with that? I used this small multiple design, and I kind of used this first one linear chart to kind of give an impression of the magnitude. But then I use all the logarithmic charts because of course they're much more comparable and they're much more able to show the growth. And they're also, of course, the y-axis is just easier to compare. So then how to scale it? There's this concept of day 0, where you have like 100+ cases. So that was very interesting. And we thought about that and we came to that choice. And around the same day, like everybody else had the same thing. So it's very interesting. You could see many people in many different newspapers on the whole world coming to kind of like the same design conclusions within like 2-3 days. So that's very, very interesting for me. So in general, I just use what I call like the multinational dashboard standards. And I think that could be interesting for quite some people. I call it like flex dimension. So I like to show this axis is the countries, and then I just be able to switch that axis between these different ways of doing it with a parameter. So that's very simple, but I think it's very powerful. And I use it really everywhere. And I feel a lot of people are not use that design a lot. And flex sort, where you can just choose you want to sort by this or that. So just all these kind of things that are very valuable in dashboards. About the data flow, I use GitHub, the John Hopkins. I use 9, which I find is an amazing tool, and it's free. And then I write a CSV and I do a Tableau extract. Of course, I have to do that every day. And since the numbers are in the US, in the beginning, I got up at 2 a.m. to refresh it, but now I do it in the morning. So I have a bit of a 7-hour delay here. Later, we started to add the lockdown measures. So I had a friend who was putting in the time to kind of like code in every country what measures were taken, and we're just showing those here. So we have like level 1, 2, 3. So I think that was a very useful addition, but of course also very labor intensive. So we didn't get much further than like 30, 40 countries. Later, we added US states and just per capita. Okay, so what is my impression of the usage? So I just kind of kept this note for myself. And so I just say how many hits there were, and how many daily hits, and what happened, because I kind of want to see. This was the first time I did anything for public, and I'm just used to very much track my dashboards internally. So yeah, I did that. So first was like this article, and then I shared it inside of Roche in a Google Plus group. And you kind of see the daily hits going up, especially once I started to add a Twitter account, which I never had before, and LinkedIn. So it went up to like 20,000 or 16,000 daily hits, and then it went down. And then now it's just, if you see here, it goes down and down, and now it's kind of like petering out. So that's the observation. I got very good feedback, like positive people, very happy. They're like, this is the best. You know, I was kind of overwhelmed by that, and also a lot of very thoughtful input. So I got, 30, 40, 50 emails with people thinking, do this. So that was very positive, just from the feedback. My conclusions is there's a lot of repeat users, because even if I don't share anything, they're still coming back. So I feel a lot of people just use it every day. And the publicity really helps. If you post something, it's going up. I felt it's kind of like a bit too nerdy to go like really broad. So let's say my mom never used it. She always used the one in the newspaper because it's kind of like easier, right? And also very important, it's like a limited shelf life. I feel it was really designed for the exponential phase. Now as we have moved out of that exponential phase, less and less people are looking at it, which I think, that I understand, it's also less and less useful. So unfortunately, I didn't have the time to, to keep changing it according to the new situation. So what are my learnings? I feel in general like the dashboarding methods for doing like a sales dashboard for 50 countries and 3 business areas is very much 80% transferable to doing a COVID dashboard for all the countries. So this is probably the only topic where you have such a data set for every country and kind of like everybody watches it. Then Tableau Mobile, it's the first time I really used it. I found it great. I think this kind of like advanced dashboarding needs are generally underserved. I think that was a lot of the good feedback, because not a lot of people do that kind of stuff, I found. So even in Tableau as an organization, I think you go to events and there's always like, the data storytelling and the fancy and the art. But like I found the meat and, is really the dashboards for most organizations. So I found that is a bit an undervalued craft, I will say, in many ways. So I think that's what showed me here too. I found the social media was really fun. It was good. I got a lot of feedback. So I kind of started using Twitter and all that. The situation changed. Now we're looking at reopening and all that. So you really need to keep working to stay relevant, because you have to change the dashboard. About Tableau Public, first time I used it, I found it's really great that it's there. I find it technically somewhat fragile, like I published and this and that, which I'm not sure was something wrong with my version or something. I found with the automated updates with the data, it's not that easy, because as I understand, you can only do the Google Sheets. And then I really surprised that you can't see any usage statistics on Tableau Public. So that's a feedback for the Tableau people here. Oh, wow, we should really have usage statistics. I find this, if you publish a dashboard and you can't see, how many people come which day. I went every day and I wrote it down. So I found that, yeah. Okay, so let's do a quick live demo. Yeah, so this is the dashboard. Oh, okay, it's reloading. Okay, so this is the dashboard. As you see, it's the small multiples. We see the cases here by status. So this is the recovered, this is the active, and this is the deaths. And then you see the total cases here, the new cases, the total deaths, and the new deaths. So there's all these, like what I say, dashboard things. So, okay, you would first think you show all countries, right? Because that's just the natural thing to do. However, when you do all countries, the US just has so many cases that the rest is just totally pointless, right? So that's often a thing that I have in a company where you have just like one business area. It's just so much big. Sorry, how many more minutes I have? 1 minute. Okay, I'm good. Okay, so I feel like, because a lot of the users in Europe, and it just looks funny, right? So why don't I just say per default all countries without US? So that's a typical thing where you kind of like break the symmetry just to serve the users in a convenient way. So then when I look at Americas, it's the same. I don't want to see US because it's just too much bigger. And in the beginning, I excluded China when it was just so much higher. So that's one thing. Then I add the US states, so you can also put a different dimension in and just show it on the same flexible dimension. And then it was also interesting to mix them up, where you can see the US states with the countries, because some people wanted to compare that. So with this way, you can just show, with one dashboard for many different people and many different user groups, you can support them without having to create 20 dashboards, which is very, very key in a company. But I think in this case, it's also key. Right? Then again, we can filter just the big cases. We can sort by cases, because I don't know how you want to sort it. Right? Some people want to sort by this and that, so I just give it an option. And then, moving averages. I think that's it. So another thing is, forever I do a dashboard, I always add the raw data. It's not so much for download, but just for people to check. And some people just always like tables. Seems like a personal choice as well. So the same here, just showing one number and then you can download it. And then one thing that was a borderline. So people always ask me, why can't you show it per capita, right? So I thought in the beginning, this capita number is not that useful, because in the beginning of the outbreak, usually it was like in every country, there was like some cities, right? So if the outbreak is only in New York and like Seattle, why would you divide it by the total population of the US? So I was a bit skeptical on that, and it went a bit into the direction where you put some kind of like a KPI where people start to think, oh, this country is worse than that, which I'm very questioning if that's a valid thing to do. So I was kind of like not adding it, but at some point I gave up after like 20 people asked me, so I just added it. But that's the only thing. I feel without that, I don't want to add anything that kind of like says, they're worse off than these or bad, not because of like moral reasons, but just because I think you can't really make that statement. Okay. Wait, do I have another slide here? No, I think that's it.
All right. Well, thank you, Jonas. And I would add to your advanced dashboarding comment, the way that you used parameters in there just to add the interactivity and to allow the user to make selections, filter it is awesome, and has to be one of the reasons why it was so widely used. So I'll open it up for any questions to Jonas. I would like, if I can, to get Amanda to chime in, because there was a question, and maybe Jonas, you can answer this too after Amanda, because your dashboard was viewed quite frequently on social media and Tableau Public. But Amanda, are you there to answer the question?
Sure, it'll be a lot faster to do this way than in the text box where I was trying to type away. So Crystal had a great question about, she said, as someone visualizing COVID data for my health center, valuable. One question I have is about how you handle non-medical, non-data people misinterpreting charts they see on social media. I tend to take that differently depending on how well I know them and how much they're amplifying that misinformation. So if I know the person well, I'll engage from a place of, can you help me understand how you saw this or why you saw it that way? And could we talk through why that might be misleading? If it's someone I don't know as well, I tend to go the route of, if they're amplifying and getting shared a lot on Facebook or Twitter or somewhere else, engage in the thread or the comments and say, hey, this chart seems misleading. Not you, person who shared it, is wrong. This chart seems misleading, and come at it from the language in a place of, these are things that kind of seem misleading about the chart, not about the person. And if it's someone who I don't know very well, I will usually gauge on if I think it's going to be effective for me to say something or reach out. And I try instead to go ahead and share information through my own channels and share with friends and otherwise about ways in which we can be better, more critical consumers of data and amplify that way. Because I think someone has to be open to that kind of feedback, or you have to feel like there's enough value in giving that kind of feedback and wading into that conversation for it to be worthwhile.
Yeah. Thank you, Amanda. Any other questions for Jonas? All right. Jonas, thank you once again for staying up late and presenting. That was awesome. Really appreciate it. And yeah, we'll be in touch. Thank you.
Okay. Thanks. So who am I giving the ball to?
Nicole.
Nicole. Wait, she's not. Okay. Yeah, I can see it.
So Nicole is the co-leader of the Tucson Tableau user group. She is also the director of performance outcomes and population health for Kodak Health, recovery and wellness. She has a master's in social work, and she's a certified professional in healthcare quality. She uses Tableau to monitor performance in order to identify opportunities for improvement. And I'm really looking forward to her presentation this afternoon on some of the lesser known side effects of COVID, the behavioral health impacts of the virus. So with that, we'll go ahead and turn things over to Nicole to present.
All right, thank you, Christian. Let me pull up my screen. I'm starting with something a little bit lighter. So right before the call, we were talking about how this week has felt so long. And this is one of my favorite moments from one of my favorite TV shows, 30 Rock. But on the bright side, it's the end of Wednesday. So there's that. So as Christian mentioned, I do work in behavioral health. And so it's been a big learning curve, I think, for us in terms of how we are delivering services. Actually, I'll leave that down for just a minute while I do a quick introduction to this. So we started delivering services remotely whenever possible, but of course, some things we do have to be done in person. So we've continued that to the greatest extent that we can. However, we knew that as soon as we were not able to provide our full range of services the way that we normally would, that there would be things that come up, of course, with our members who are oftentimes, dealing with crises on a regular basis and coming in for different needs related to those crises. So in April, we started seeing, or even I think late March, we started seeing a decrease in hospitalizations, which is one of the indicators we track most closely because it's, first of all, it's a good indicator of how someone is doing in terms of their mental health. If they're doing well, they should not be in the hospital. And secondly, of course, it is a really costly indicator too when people are going into the hospital. And we want to keep people healthy and not costing the system a whole lot of money. So we started seeing that decrease, and we were really surprised at first. We thought, first of all, we have a vulnerable population, so we weren't sure we would see maybe potentially higher rates of COVID-19 infections. I will say that we have a huge limitation that we don't always know when people go in the hospital, which is totally bigger discussion that I won't get into today. And then we found out that that was actually a trend around the county, that there were decreases in hospitalizations because people are staying home. And so they're just doing their best not to go anywhere, including the hospital, unless they absolutely need it. Then in mid-April, we received this from Pima County Health Department stating that there was a really significant increase in suicides, completed suicides in the county. So you'll see here that during the first half of March, there were 7 suicides, and then during the last half, 15. So more than double just from the beginning to the end of March. Unfortunately, we don't have any April data here. Of course, there's a lag in terms of when data is available. But when we saw this, we knew that there were things that we would need to be paying attention to a little bit closer with our internal data. So what I'm going to do next is just show you the Tableau dashboards that we use on a really regular basis and how I've kind of adapted the data that we're looking at in order to keep a better pulse on our business operations as well as our members' mental health. So this first dashboard is our KPI, Key Performance Indicator dashboard, and this is really high level what we like to show to our board of directors and what our executive leadership looks at on a regular basis. And a lot of these are tied to, again, outcomes and our business functions. So as we're going through this, I'm actually presenting this to our board on Monday. And one thing we've had to do is sit down and go through and look at these and say, okay, which of these are actually affected by COVID-19 right now? So for example, we have staff metrics, which just shows us what percentage of a person's time they're able to bill for in terms of billable services to our members. And usually this is well above 100%, but right now we're at below 100%. That's because of changes in the way that people are delivering services, even with changes to telehealth and being able to do that a little bit more. We're still down a little bit, and partly because people aren't coming in or trying to make appointments as much because they are staying home. Another thing we have on here, of course, is going to reload right now in the middle. Below that, you'll see a line chart, and that shows our enrollment month by month. And we've noticed that our enrollment is also down right now because, again, we don't have people coming in as much. We think that people are possibly also not always renewing their access enrollments, their Medicaid enrollment here in Arizona. So we've seen those numbers go down a little bit as well. This chart again shows our intakes, and like I mentioned before, it's down a little bit. In May, we've only had 25 so far, and that's pretty low. But that's one thing that we decided we needed to look at a little bit differently because of COVID-19. We've always tracked when we see people face-to-face, and normally we can see about 2/3 of our members in that 90-day span. And right now we're down to 58.5% because in the past, we never actually really had to count telehealth services as a face-to-face appointment. And so now we're having these discussions of, is that something we need to change in terms of how we're thinking about our data? And does a face-to-face appointment via webcam give the same level of service as a face-to-face appointment in person? So those are conversations we're still having, and it's pretty complex question, honestly. We decided that in order to address that, we're going to actually do some satisfaction surveys with our members who are receiving those services so we can gauge whether they feel like they're still getting the same level of service using telehealth versus in person. And once we have a better gauge on that, then I think we'll know, okay, maybe we can include those face-to-face webcam appointments as an in-person, they're kind of equivalent to an in-person face-to-face. Satisfaction and our social determinant indicators thankfully haven't actually been impacted. We don't know if we might see an increase in homelessness, unemployment, things like that, but those numbers tend to come a little bit later. There's a lag on that. So I think that if we do see that, it'll be down the road a little bit more. And then moving on to our hospitalization measures. So we did start seeing that decrease in hospitalizations in March. In April, they were a little bit below what we've been seeing because we had an increase. Our readmissions started going down, which is great. We want them to be low, but we know that it's because of this that's happening. It's not anything we're doing, sadly. Giving our members the opportunity to stay out of the hospital because they're healthy. It's really just the social landscape right now. And then we saw a big increase in crisis utilization. People going to the crisis response center here in Tucson, and then also just presenting into EDs, emergency departments. So when we saw that, we knew, and again, from that bulletin from the health department, we knew that these were things that we needed to look at a little bit closer. So we always actually break down that data and look at it in a different way so that we can hone in on it a little bit. So this is what we normally look at for those indicators. But this monthly monitoring just isn't really cutting it when we're looking at what are our members doing on a day-to-day basis, on a week-to-week basis. So I ended up taking that and breaking it down into a week-by-week run chart. And for people who might not be familiar, run chart is really the most common way to track and monitor performance over time in healthcare and in other settings too, but it's just really common in healthcare. And so there it goes. And so this is just super, super simple, but as it turns out, that's actually all we really needed. So I just broke this down in terms of hospital admissions on a week-by-week basis. So I went back all the way to January 1st so we could see on a weekly basis what were our baseline admissions. And we had a median of 45.5, it looks like, per week. And you can see that they went down for a while, but now they're actually starting to go back up. Our most recent week, we don't have all the data entered for last week yet, so that's why this number is low. And then we also needed to pay a little bit closer attention to why people were going into the hospital. And so, of course, I made these so that we can filter on them. So let's take a look at suicide attempts. We did have a really big spike the first week in April. And of course, 5 seems like a low number, but as we've been talking about, it's really about the people behind the data. 5 is a small number, but when you think about 5 people attempting suicide, it's a big deal. And so that was a pretty big spike. And again, it still stayed pretty high since the start of COVID. And then we did a similar thing with our crisis encounters. One thing that we also did here was we actually made a change to our health record this week, the week of April 19th, so that we could start tracking ED visits better. So this increase is actually largely because we're tracking better now. However, even before that change happened, we did see an increase in crisis encounters, so ED visits or people going to the CRC for things like suicidal ideation. And so we filter out here. I'll just do it down here. I think it's a little bit easier. So mid-March, we definitely started seeing a spike. It went down a little, but it's been really, really high. This has been a really great way to see this data, at a higher level. In terms of how we're using this for care management, this is, we use our dashboards mostly for our leadership team to see. And so this data let us know we really need to be doing a little bit more to make sure that our members feel supported during this time. So after we saw these numbers, we started a new process wherein we have people reaching out to members that are on our high needs team or that we know have had a crisis encounter recently. We send the lists out to our staff on a weekly basis so they can see who's been into the emergency department. And our QM team is working on that actually daily as well, making sure that we get follow-up calls out to people. And so that's how we've kind of mobilized this data. And again, it's really simple, but as it turns out, that's really what we needed. It was a simple solution, and thankfully in Tableau it was, much quicker than it would have been for me to do this in Excel, which we're still transitioning over everything because I know that there are some people in behavioral health on this call, and you know that things can move a little bit slower in behavioral health and in the nonprofit world than it does in other places. So, and then just finally, one last thing I wanted to share was that this, of course, looks really weird here. I'm not sure why. But we also just decided to start looking at our intakes by week. So we had a big decrease in people coming in, new patients coming in. And this has been really important for us to keep track of because we need to know, of course, how many people we're serving. And after we saw this, we got that insight and we were able to dive deeper, and we found out that although we have fewer people, fewer new people coming in, we're actually serving more people now, just a lot of it's over telehealth. That's actually being broken down, not in Tableau, because again, we're kind of moving things over a little bit slower and we're looking at that, those queries in SQL. But it's been really great to see the way that the data that I can just pivot really, really quickly in Tableau can support what our business analysts are pulling in SQL from different data sources. We've been able to mobilize that so that our staff can better support our members, especially those who are highest need and most acute cases. I think that pretty much covers it. I know I flew through that. Are there questions? Okay.
Yeah, I think I'll just say that's just a really amazing example of using data to possibly save people's lives, right? I mean, that's what you were talking about in terms of mobilizing people to follow through with high at-risk patients potentially based off of the trends you're seeing in that line chart.
Absolutely. Yeah. So hopefully, and I mean, we have we serve around 10,000 people right now. It's a little bit lower because of everything going on, but even with that, we hope that we can make a dent to flatten the curve of suicide attempts and completed suicides as well, because it's really not just the people ending up in the hospital with COVID-19, it's the people who are suffering from social isolation, economic hardships in these times, and there's definitely more than one curve that needs flattened.
Yeah. Wow. Thank you so much, Nicole, for
Thanks,
presenting.
Hugo. All right, is Devin up next?
Devin is.
I think so.
Founder and principal of Viable Insights. Devin Wisner has created a dashboard, publicly available dashboard with the CT Data Collective to provide insight into the situation on the ground in Connecticut, I believe, in terms of COVID. And special attention was paid to the needs of the institutions in the state. Data was broken down by key points and aggregated by day and adjusting for geographic anomalies within the state. So Devin is going to present to us what he put together with the CT Data Collaborative. And thank you, Devin.
Yeah, hey, really happy to be here. And just to be able to learn, I think, and reflect on all of these different dashboards. Amanda, specifically, I'm already thinking of some things I'd like to talk with the CT Data Collaborative about to just kind of enhance this, right, and do our responsibility. So thanks again for everyone for sharing. On a lighter note, Nicole, I would love if the Kahoot, the preferred morning beverage now, I think in light of everything going on, has got to be a mimosa, I think, at this point, right?
Is whatever, I'm in support.
There we go. That's right. So I guess just chatting briefly how this data visualization opportunity came about for us is that our team had responded to, I'm not sure if there's any familiarity with the Data Visualization Society. They had actually put out a call for COVID-19 data visualization assistance, kind of doing a matchmaking or kind of a matchmaking model, if you will, to public health organizations and those who are in the data viz world, right? So actually, before they even got back to us, I have a colleague, Elizabeth Grimm, Director of Community Impact at the CT Data Collaborative. She had reached out about publishing a simple dashboard that they had begun envisioning to really supplement the Connecticut Department of Public Health, the dashboard that they had released. And a lot of this was based off of the need that CT Data Collaborative was recognizing through their partner agencies, which, similar to Viable Insights, they do a lot of data capacity building work throughout the Connecticut area, oftentimes working with public health offices, nonprofit organizations, foundations. And what they were hearing from some of their partners is really that they were looking for something that was timely, but also that broke things down by a town. I'll get into that just a little bit later. Connecticut, I learned something. Does things a little bit differently than some other states, at least how we do it out here west. So taking into some of those considerations for them, as well as not just aggregating data, but understanding what was happening on a daily basis, right? So hopping back to the dashboard, I think, like many of us, when I think about just the development and design considerations, the visuals that the collaborative was really looking to achieve wasn't necessarily complex. Again, they wanted a couple bar charts, which we ended up agreeing on doing some line charts, with a bar chart and some mapping as well. But really the problem, what we found, was the timely piece, right, and the data source piece. So they wanted to continue using the data source that the public health office was putting out, but that required just a little bit of reformatting. So for us, I guess on a technical side, doing a little bit of hunting on how we could leverage Tableau Public, since although I develop in Tableau, it's primarily internally facing and pretty rarely anything on Tableau Public, except when Christian says, "Hey, Devin, you should do something on Tableau Public." So after chatting with him and a few others, figuring out that we could probably use Google Sheets to do something that would be just a little bit more timely for us, but also cleaning up that data source, right? So I would say that took us the majority of the time. Ultimately our goal was to provide back to their partners some of, what I would say is some simpler figures, right? At the same time, they weren't looking for interpretations. It was just to have an understanding, just to have a pulse of each one of their areas, as well as to better understand things by day versus just aggregates, right? So technical considerations that I wanted to go through or talk about what was interesting. I think perhaps Jonas touched on it. For us, we struggled a little bit with the Google Sheets function. The auto refresh was not quite as great as we were hoping it would be, but eventually we got over that hurdle, and it actually turned out to be pretty fantastic. So pleased with that, and happy to see that that's something that ended up being released. But I had mentioned earlier talking about cases by town. So if you aren't familiar with Connecticut, they're actually their government levels is not at the county level, but instead it's by town. So for us, took a little bit of finessing, as Tableau doesn't do town level data super well. So luckily we were able to do just a little bit of digging, and the University of Connecticut had done a really nice job of breaking down how to create a custom polygon map. And we were able to achieve that choropleth map, which was ultimately what the collaborative was looking to have. So cool resource there if you're ever doing anything related to Connecticut. So thinking about just how this has been used, again, this was a collaborative effort, and so kind of bringing some of what their vision was to light, adding in some data viz best practices, not saying by any means that there isn't some opportunity for improvement, but I think it was to get something that was fairly straightforward out to their partners that could be used as a reference. And I know that several news outlets, what they've reported back to me, such as like the Hartford Courant, have been using it on a daily basis, as well as nonprofits and health agencies like the Hartford Hospital, Institute for Community Research, Hartford Foundation for Public Giving. So I think through that, we've been able to achieve, at least personally for me, the most like Tableau views. I don't think it was really about that. It was surprising to see just the level of engagement that was there. And I know it was kind of inspiring for the collaborative, because it really reaffirmed what that call was, right? And that they were able to kind of answer that request from their partner agencies. So overall takeaways I think that I would share is, this idea is that when we sometimes rush to compile visuals, and this is not to speak ill of the Department of Health or Public Health in Connecticut, but it's easy to forget some audience members and maybe some ways that they might want to disaggregate some of this data, and especially as we start talking about breaking this down by town and by day, that was something that was relevant for quite a few stakeholders throughout Connecticut. So I think it was, certainly speaks to the collaborative's attunement, right, to take the time to really identify some of those needs and start to build out something that shows that change over time. I also think, just from a capacity building standpoint, sometimes it's all about getting people started, right? So the collaborative really didn't have a Tableau developer, but this is, just getting started with this one dashboard has inspired their data analysts to focus more on this. And, since I've kind of left this in their hands, they've already developed several other sheets, as in this as well, which I think provide some really key and timely insights for their partners. Again, this kind of being the starting place that started to create some of those questions that their partners had, so they were able to kind of tailor it to them after the fact. So I think that's pretty great. Again, it's what I would consider a fairly simple dashboard. It's got some of Steve Wexler's big ass numbers, some line charts, and a map. But I think, again, just understanding what the need is and not trying to overcomplicate or over deliver. I think it's easy to sometimes think about, let's make the sexiest data viz, but there was some questions and a need, and so just to be able to meet that in a timely and efficient manner, I think made this just a pleasure to be a part of. So I think I went fast, but that's what I got.
Very cool. Thank you.
Yeah, you got it.
Any questions for Devin?
Can I actually make a quick shout out? Thanks for the call out for the COVID-19 matchmaking piece from DVS, Devin. That was very exciting, because that's something that I spun up and ran. We have not had a ton of demand from organizations, but we have We currently have over 650 enthusiastic volunteers who have signed up. 650. So if you know of any organizations who have data that with some kind of sharing agreement or otherwise might be interested, that form is still open. We are still happy to match folks. We've got like some one-on-one advising to public information officers happening. We've got some dashboarding work. We've been doing work with a hospital in Thailand, dashboard prototypes and things. So there's been some really great matches that we've made, but we're flush with volunteers and enthusiasm and lean on the organizations asking for help, which I know takes effort to like coordinate and put together the scope. So if anyone knows anyone good, that opportunity is still open and we still love to match people up.
I'm sorry I didn't make that connection. If I had known, I would have totally like connected that. But yeah, it was crazy. We submitted our application and it was like a couple hours later, Elizabeth was like, could you help with this? And it was like, I just need an hour. And I love Elizabeth and we've had this conversation, but it's like if you give a mouse a cookie, right? This turned into like the biggest thing ever. But it's been great and we were happy to be able to help out with it.
I love it. It's a great visualization. It's a great dashboard.
Thanks. All right, I'm passing it to you, right, Christian?
Yes, sir.
Right. There you go.
Okay, so my name's Christian Felix. I am a programmer analyst at Roche. That's the pronunciation, my best Swiss German accent. And I've been here for 5 years, work in Tableau, primarily doing data visualization and analytics. And I'm involved in Tableau Public, just doing learning projects on the side. And I'm active on Twitter as well, at the C Felix. So I wanted to start with a few numbers. These were pulled yesterday from Worldometer, I believe that's the site.com. 3,719,891 COVID cases worldwide, 963,387 active cases in the US, and almost 16,000 COVID data visualizations published to Tableau Public since the 1st of January. Big numbers, with all of it leaving us with the feeling of information overload, right? So many voices throwing so many different numbers and figures at us, it kind of just makes me at least want to break away from it all. Having said that, there's this recognition that there are people who are on the front lines of this thing, certainly the doctors, the nurses in the hospitals and clinics, the scientists developing tests to treat the virus, the grocery workers making sure the supply chain stays active and our shelves stay occupied. And so apparently, based off of Amanda's comment, I'm not the only one, but it kind of leaves you feeling, as a data visualization specialist, what can I do to help? You know, you want to some way offer up your skills and offer services to the world in this time of trial. It kind of left me for a while feeling like, okay, I just create charts. What do I have to offer? All the while being bombarded with messages to flatten the curve. We have to get the curve flattened. And really, throughout the weeks, months, I really found myself asking the question, how do we know when we're flattening the curve? What data-driven thresholds are we looking at to know if it's been sufficiently flattened, right? There's got to be, I would think there was some number that we could look at and say, this is what we're trying to measure against to understand if we've done enough to flatten the curve to let us start reopening things. This is a map from the New York Times, and it's helpful to the extent that it localizes the case information. So we're looking at cases, and we're looking at the size of the circles by confirmed cases by county. So it's a good start. It helps us understand what areas of the country are experiencing a high case load and what places are not, but it doesn't quite get us all the way. Here's another graph from the Financial Times. This is something like an electrical shot graph, where here we're starting to understand a little bit more about the question, is the curve being flattened? We see some countries, certainly their curve looks like it's flattening, but it doesn't really directly or explicitly address the question of whether or not we're flattening the curve. It leads us to maybe visualize an answer, but it doesn't quite get us all the way. So as I was looking through information on this, I came across this document put forth by the American Enterprise Institute. Former FDA Commissioner Dr. Scott Gottlieb led a team and really put together a roadmap for reopening the country. I appreciated it because it contained specifics. It contained data points that we could look at and say, this is where we want to start seeing things before we're comfortable moving on to the next phase. So this phase 1, for example, is slow the spread. When this report was released, the US was already in this phase. We had taken measures to start to slow things down. But I highlighted a couple points that really caught my attention because they were helpful to me. So the trigger to move to phase 2 says the trigger for a move to phase 2 should be when a state reports a sustained reduction in cases for at least 14 days, one incubation period. So it's talking to a condition where cases are decreasing on a consistent basis. And of course, it gives additional items that are also important. When local hospitals are safely able to treat all patients requiring hospitalization without resorting to crisis standards of care, and the capacity exists in the state to test all people with COVID-19 symptoms, along with state capacity to conduct active monitoring of all confirmed cases and their contacts. But for somebody like me who was looking for information to understand, just as a curious citizen, when we can start to at least look towards reopening, this report was very helpful to me. And since then, there have been all sorts of various charts produced to help us understand what's going on, some more helpful than others. This is looking at excess deaths in a bar chart by county from the New York Times. From the journal Vox, looking at confirmed cases, deaths, tests conducted, tests per million people. But again, we have all this information, all these charts, and I hadn't come across anything that really, at least that I saw, maybe it existed, addressed some of these key, or at least one of these key gating criteria to allow us to understand when we can start to reopen. And so this is something that we've always challenged, our internal team at Roche have always challenged ourselves with, making sure we're incorporating into our designs and dashboards. Really, we want the dashboard consumer to be able to answer the big question, the reason why they're going to the dashboard in the first place within 10 seconds or a few clicks of looking at the dashboard. And so as I sort of surveyed the landscape of visuals on COVID, I couldn't do that. I couldn't answer that 14-day threshold easily with any of the visuals. So a couple of weeks ago, the White House released their gating criteria, and it included the same language, right? So the roadmap to reopening was released in late March. The White House released their criteria, I believe, a couple of weeks ago, and it again contained this language of, okay, before we reopen at a regional level, we want to see a downward trajectory of documented cases within this 14-day period. So I went from this posture, and Amanda alluded to it, of, it's probably, do I really have anything substantive to offer to the conversation? And if I'm honest, the answer is most likely no. But what I found myself doing is just saying, I think it would be helpful, at least if nothing else, to satisfy my own curiosity to understand what counties within the country are at least getting close to, or if not already met, this 14-day piece of criteria. So that's really the impetus for this visualization I put together. And this is a quote that I found in Edward Tufte's book, and I think it's applicable here, is everyone spoke of an information overload, but what there was in fact a non-information overload. So it's really, once again, going back to what is the critical piece of information that we need to understand as a population, as a country, before we can actually start talking about reopening. And so that, in my mind, I convinced myself was worth taking a plunge to visualizing COVID data. And so I did that. So really the big question for me was, what locations and counties in the US are experiencing a downward trajectory of cases, confirmed cases, within a 14-day period? This is an example just of one county, looking at Orleans County, Louisiana. What we're looking at is in blue, the 3-day moving average rate of case increases. Because although it may feel like Groundhog Day during this quarantine, there was seasonality associated with the data, whether more people are likely to get tested or not on weekends. It seemed to show up in the data. So we took a moving average, looking at a 3-day period of confirmed cases, and then just compared it to a 14-day moving average, looking at that sort of one incubation period. And then what I did was I just compared, is it above or is it below that 14-day moving average? I then counted the days that there was sustained trends. So where it was above the 14-day moving average, this is column C here, it was increasing. Where it was below the 14-day moving average, I labeled it as decreasing. And then I just used Alteryx to create a running sum of those days. So when the subsequent row was the same as the row before it, a new number was generated in that pattern. And so ultimately what I did was I ended up with various color encodings to represent whether or not a county was increasing or decreasing, ultimately with the intention of allowing the consumer to see, easily see if their county or if the counties around them were decreasing at a sustained rate for 14 days or more. So applying the color coding back to the Orleans County chart makes it easier to understand. So when the confirmed case rate for the 3-day moving average drops below the 14-day moving average on a consistent basis, that's when you start seeing blue. That's when you start seeing those sustained consecutive days of decrease. Ultimately, I ended up with this map, right? So wanted to look at it across the US. So this is just a GIF of a Tableau dashboard using the Pages shelf that shows by county whether or not that county is experiencing an increasing sustained rate or a decreasing sustained rate. And to me, this was powerful for somebody that was sort of mired in quarantine, wanting to have some semblance of hope. Seeing that map turn blue was like, yes, okay, there's a light at the end of this tunnel. But there's two things that I want to bring up about that. First is just a tip, right? So there's a free tool, open source tool called mapshaper.org, developed by, I forget the guy's name, but he used to work at the New York Times. It's open source. It'll help you create a US Albers projection of the US. So you're not dealing with that situation in Tableau where you have Alaska basically consuming the entire visual. So you put Alaska and Hawaii in a nice needy spot just south of California and Arizona. That allows you to still see trends associated with those two states. The second thing is looking at the Johns Hopkins map, a map that I think we've probably all seen at this point. It's easy to be fooled by these county level chloroplasts, right? Because immediately we see the red, we see California and Arizona. At least that's where my attention is drawn to. But the hotspots in the country aren't really in California or Arizona. That's not where the significant amounts of people are experiencing the coronavirus. It's in New York and New Jersey. So really the square mileage associated with the counties gets in the way of a true representation using this chloropleth viz. So I don't know if Andy Cotgrave said this. I for some reason think he did. If he didn't, it sounds like something he would have said, but it's true, right? So every chart's a compromise and every chart can be complemented by visualizing data differently. And so, yes, I wanted to produce a visual that showed the county level chloropleth map because I thought it was a powerful view and it allowed the viewer to really geographically and intuitively understand what was happening in the country. But I didn't want to stop there. I also wanted to produce some other visuals that probably provided a more realistic look at what was going on the ground. So I created strip plots. So these strip plots represent a 30-day view, and therefore in the visualization, the top 70 counties by confirmed case. And really it just, where the chloropleth sort of distracts you based off of the square mileage. These strip plots, front and center, the very top, put the hot spots in the country. So Nassau, New York, at this period in time was where the most confirmed cases were. So we're able to see very quickly what's going on with the hot spots in terms of the virus quickly. I also, in addition to looking at the strip plots, I also wanted to visualize how things were trending another way. So doubling times. How many days is it taking for case counts, confirmed case counts to double? I added in some spark lines to allow people to see what the doubling time was doing. The red dots in those spark lines represent the lowest period in that 30-day window of doubling time days. So really what you want to see is those low doubling time days on the front end of that window. It means doubling times are increasing as the 30 days transpire, and the curve is, in theory, flattening. All right, and so I created a desktop visualization that included the choropleth maps. I did it so that the individual or the user can look at 4 different points in time. So they're able to see not just a single point in time, but they're able to see looking 10 days in history, 20 days, 30 days, and 40 days, what's transpired. So it really provides this multidimensional view of what's going on. And it's all looking at that trajectory. It's not looking at raw case counts, it's looking at increases or decreases on a sustained basis. And I had a lot of help. This was not a solo project. Anna Ford processed a lot of things with me, as did Amanda, in terms of challenging me on some of the things that were in the visual. So I appreciate all of their help. And yeah, Jonas mentioned a mobile view. I also created a mobile view for it that I thought came out really well. I don't do a lot of mobile development, but in my mind, I even like the mobile view better. It's all right there. It shows a header that gives you the legend, and it allows the user to select a state and even access the same sort of instructional icons as the desktop view. So again, the main objective for this for me was to try as best as possible to directly answer the big question: how many counties, what counties, where are the counties that are meeting that 14-day gating criteria? And hopefully I did that. So that's all I have, and I'll open it up for any questions.
We do have one question about how much time you've invested to set up the mobile view from Crystal.
Yeah, the mobile view was quite easy, actually, once the desktop view was in place. It is sort of a different animal, and I don't regularly develop for mobile, but once I had all of the worksheets and the visualizations created, it was basically just reusing them, resizing them, and then testing them. There was only 1 or 2 components that I needed to recreate from scratch, basically, for the mobile view. So. Any other questions? How is Pima County doing? I think I saw that from Manoj. Well, that's a good question. I think we were looking at Arizona the other day with my daughter, and Arizona is one of those states that has lagged behind in testing, and they're doing somewhat of a testing blitz at this point. So you have a lot more tests flooding the market, but they're orange. You know, the state is predominantly orange, which means cases are increasing. I don't know Pima County specifically, but when I looked at it a couple nights ago, the state was orange, indicating that we may not be, as a state, hitting that 14-day criteria yet. I'll share the link, Manoj, and you can certainly go out to Tableau Public and filter around and look at Arizona yourself. All right. I think that's it. I think we just wrapped up, unless there's any other questions. The first ever.
Sorry, we do have one more question.
Okay.
From Mike, why did you use Alteryx? Was it just prep or did you do modeling?
It was just prep. The data source was getting fairly large, and so I wanted to produce as many of the calculations as possible within the data source, just for performance sake. So Alteryx was pretty helpful for that. All right.
I think that's the last one.
All right. Well, thank you, everybody that stuck around to the end. This was helpful for me. I hope it was helpful for everybody else. Thank you again to all the presenters. And I think, do you want to announce anything, Nicole, in terms of what we have planned going forward for next month? Or
well, yeah, I think that we can let people know that in June we are hoping to have a virtual statewide meeting. It's something that we had been talking about even before everyone kind of went into lockdown, but now it's kind of an even better opportunity, I think, to leverage this ability to have a virtual meeting, especially bringing together the Phoenix and Flagstaff user groups. So we don't have any specific details on that right now, but just want to let you know that we're working on it. And again, that should be some point in June. And then hopefully when it's safe to do so, we can resume in-person meetings. But until then, we are still working on virtual programming, as much as we can.
yeah. Cool. Well, thank you guys.
Yeah. Thank you all.
See ya.